Let's talk about the three key nutrient deficiencies that are involved in sciatica. And if you took these three nutrients, the chances of you getting better are pretty darn high. And then at the end, I want to show you two amazing stretches that don't stretch the muscles per se. They stretch what's called fascia, which extends beyond the joints. And these stretches are amazing because what I found is you can have scar tissue in certain areas of the connective tissue around this nerve from an old injury, like a fall on your tailbone or anything, that if you don't stretch the fascia, chances of you getting better are less than winning the lottery. The sciatic nerve is the longest and largest nerve in the entire body. It comes out of the lower back. It goes down through your buttocks on the back part of your leg, all the way down to the foot. You can get pain anywhere on this nerve if you have this problem. A common test that they do is they have you lie on your back and they lift up the leg. It's called a straight leg raiser. And of course, it's putting traction on this nerve that's coming out of your lower back. This means that there's some type of pinching going on somewhere in that nerve. Now, what I don't like about the advice that medical doctors give you about sciatica is I don't like to hear, you're going to be on medication the rest of your life. But if anyone tells you that, they're not telling the truth, because there is so much bias in this area, unpublished studies that show bad results with sciatica. And of course, Big Pharma will only selectively show you the benefits of drugs. But here's the data with surgery. After 1 year, there really is no benefit of that surgery compared to other treatments. So if someone tells you that surgery is the best option, I would take a step back, look at the actual research, and you're going to find out it's not always the best option. I mean, if you absolutely need surgery, yes, but there are complications for surgery. One is called failed back surgery syndrome, where the surgery doesn't work, but now you have pain. It's an invasive procedure. I would only recommend it as the last resort. Today, we're going to share some fascinating information relating to the disc. 90% of sciatica pain involves your disc. You also hear that 90% of the time, someone with sciatica will pretty much resolve their symptoms if they do nothing within 6 weeks. It's very interesting to me that sciatica pain gets worse during the winter months, which gives you a big clue with the first nutritional deficiency I'm going to talk about, and that is a vitamin D deficiency. This whole concept of using like 600 to 800 IUs or even 2000 IUs is not going to work if you have some type of serious inflammation. And so right off the bat, all the research that's using low doses of vitamin D is invalid. The second thing, and this is really interesting, if you're taking vitamin D on a weekly basis and not on a daily basis, you're not going to see consistent results at all. There's actually two different systems of vitamin D, one for calcium and bone and another one for everything else. And that everything else dosage needs to be higher, and it needs to be taken daily. So the first thing you need to know about vitamin D is that the disc has a lot of vitamin D receptors, because if they have metabolic syndrome, if they're a pre-diabetic, unless they're taking large amounts of vitamin D3, it's not going to really penetrate and go into the disc. Just think about, what is the number one symptom of a vitamin D deficiency? Lower back pain. Why do you think that is? That's because the discs need vitamin D desperately. And when you don't have vitamin D, everything kind of falls apart. Vitamin D is the most potent anti-inflammatory that exists. It's similar to prednisone, which acts as an anti-inflammatory, but vitamin D does a similar thing, but without the side effects. Vitamin D also has a function of repair the nerves, as well as the disc, as well as the connective tissue, as well as the muscles. So we got the vertebra here, have the disc in between, the nerve, another vertebra right here. If there's any problem in this canal, but vitamin D is essential to support that disc. All right, so vitamin D is the first nutrient deficiency involved with sciatica. The second deficiency that's involved with sciatica is a magnesium deficiency. So if you have some type of arthritis or what is called stenosis of that spinal cord, so all the extra calcium deposits, arthritis is controlled by magnesium. Now, this also applies to muscles as well. Think about it like this. Calcium controls the muscle contracting. Magnesium controls the muscle relaxing. So having enough magnesium is going to be really important in keeping all the muscles in a relaxed state. Another fascinating thing about magnesium is necessary for vitamin D to work. So vitamin D and magnesium are like two peas in a pod. The other interesting thing about calcification or calcium in the soft tissues involves another vitamin called vitamin K2. Vitamin K2 is all about keeping calcium out of the arteries. Well, guess what? Magnesium is necessary for vitamin K2 to work. All of the processes in the body that involve energy are dependent on magnesium. Magnesium also has anti-inflammatory properties, decreases adrenaline and cortisol, the two stress hormones. And one last thing about magnesium. Magnesium allows you to go to sleep at night. I want to wrap up with the last deficiency, B12. And the term for it is called neuropathy. Because vitamin B12 is intimately involved with several aspects of the nervous system. You can have numbness, tingling, burning type pain. So B12 also is anti-inflammatory. And so those are the three nutrients. Now, the question is, how likely are you to have a deficiency of all three of these? It's very common. Let's first start with vitamin D. Most people don't get enough sun. And unless you're taking at least 10,000 IUs on a daily basis, you're probably going to be deficient. If I had sciatica, I would take probably 20 to 30,000 IUs of vitamin D3. But of course, make sure you take it with the next nutrient, which is magnesium. If you're going to take a magnesium supplement for sciatica, I would take probably 800 milligrams. Some of the best foods for magnesium would be sunflower seeds, pumpkin seeds, chocolate. Try to get the one without very much sugar. Almonds, spinach. Now, the problem with spinach, almonds, and chocolate is they're also high in oxalates. Oxalates tend to form as kidney stones, but they can also cause arthritic type symptoms. But if you have a little cheese with all three of those, you will have less oxalates. You can also get magnesium from leafy greens in general. There is also magnesium in bone broth if you don't consume any vegetables. Alcohol is one of the things that will deplete your magnesium. Eating refined sugars and starches can deplete your magnesium. Now, as far as B12 goes, that's really easy to get if you consume red meat. You can also get B12 from liver. You can also get B12 from any animal products, but not vegan foods like plants. You can't get B12 from that. So if you are a vegan, you would need to take B12. You need a certain form of B12. You need the more natural version called methylcobalamin. Now that you understand the three nutrients, now I want to roll right into these amazing stretches. Save this video and do these stretches until you commit them to memory. And then do these every day until your sciatica goes away. This first stretch is going to be involving you sitting on a stool or a chair. You're going to position yourself like my person who's demonstrating this. So you have your left leg out in front where your right leg is bent, and take your shoes off. And if you have your socks on, you could easily glide your foot going backwards. So you're going to mimic the stretch that you're seeing on this video right now, where you're creating this scissors-like action and you're stretching all the fascia on your right hip and abdomen area. So in other words, the sciatic nerve comes on the back part. You're going to be stretching the front part. And this is going to give a lot of slack and relaxation in the back part of your leg, the buttocks, as well as in your lower back. Okay, we're going to do the other side. It's important to do both sides because we want to create symmetry. You're going to find one side is usually tighter, and you're going to probably work more on that side than the other side. So go ahead and switch sides and follow along. Okay, for the last exercise, you're going to be standing, you're going to hold on to something, and you're going to basically start with your left foot. You're going to bring your foot up on your back, and you're going to hold your foot, and you're going to stretch the front side of your thigh. Go ahead and follow along with this stretch. Now let's do the opposite side. All right, so now you have the information about the three most important nutrients to support the sciatic nerve, as well as two very powerful myofascial stretches. So combine both of these together to say goodbye to your sciatic nerve pain.